So, a real quick review before we dive into the specifics of this particular force couple around the shoulder, which, as we talked about before, a force couple is a group of two or more muscles around the shoulder or the shoulder blade and the shoulder itself that create harmony and balance for those joints in that area. And when things are thrown off and those muscles are not balanced the way that they should, it can lead to or cause ongoing or chronic shoulder pain. And the pain might be constant in some situations where things are really aggravated and flared up, or it may come and go and get better or worse depending on what types of lifts or how many days per week or how much overall volume of weight training that you're doing at that particular time. In this particular case, we're going to be taking a look at what's referred to as the deltoid rotator cuff force couple and how things look when the balance is thrown off between these two different muscle groups, along with a real quick overview of how we go about addressing this particular issue and this particular cause of ongoing or chronic shoulder pain. So, as we can see in this video, this big red muscle, fan shaped muscle here, is of course our deltoids, which we do have multiple different heads or multiple different parts of the muscle. And then working in opposition of the deltoids, we have multiple different muscles here in beige that are part of the rotator cuff, which of course our rotator cuff is a group of multiple muscles, four muscles in this case, that form a common attachment to the actual ball portion of the ball and socket joint. So as we can see in this video, when there's an imbalance here, going here, we can zoom ahead. So if we can see in this case, again, referring to the balance and the force couple between the deltoid and the rotator cuff, we'll get our deltoid muscle here in red oftentimes is doing more to pull that ball up and out away from the socket and the shoulder blade where it normally should sit, versus what our rotator cuff here in beige is doing to pull the ball and socket, or the ball portion of the ball and socket down and in from there. And when there's an imbalance between the forces here, it'll throw off the position of the ball in the socket. And then when we add weight or additional stress or repetition on top of it, it can create friction, overload different other structures around the shoulder, and cause structural damage. But in many cases, will just cause inflammation and pain and prevent you from lifting the way that you want to or lifting as frequently as what you would like to, because the shoulder is getting flared up and irritated because of this imbalance. And then we'll typically work on creating more balance and offloading tension a lot of times from a deltoid muscle group that's working too hard. And then we'll restore activation, start getting the rotator cuff to build back up to kick in order to create more balance and harmony between these two muscle groups.